Okay, health and wisdom. We were talking about the germ theory of diseases, which dominates Western materialistic medicine at the present. And we're trying to use some common sense, and we have a kind of anomalous situation, which is that when these germs are supposedly present in the environment, not everybody gets the disease. You know, you'll have a school, for example, where these kids have lots of contact with each other, and the disease will go through the school, and maybe, a cold will come through the school, and you get 10 or 15% of the kids with runny noses, maybe more. If it's a flu, you might get more, but not everybody. If the nature of the organism, of the germ, was such that it overpowered the physical organism in all cases simply by being present in the environment, everybody would get sick from it, and not everybody does. And of course, again, I'm saying, this is complicated. Educate yourself. Don't jump to conclusions. Try to be reasonable. Trust your intuition. In a lot of cases, for example, if you're a mother or a father, maybe you'll want the vaccine. Maybe that's the best thing to do. But we're talking here about the relationship between health and wisdom, and we're talking about new knowledge, new wisdom that's up to the level of scientific inquiry in the West, which is what we talked about in the previous lectures. So investigate these things. Now, you can look up anthroposophical medicine on the internet and you'll find a lot of material. You will find, interestingly, and it's an interesting social phenomenological fact, that in America there aren't a lot of anthroposophical physicians, and it's a real interesting question why this is so, and I think it's complicated why there are not. There are a lot of anthroposophical physicians in Europe, and in the Americas there are like 300, plus a hospital in the Brazil. And in North America, in the United States of America, there are less than 50. And one of the questions that one runs into, and I'm going to have to talk about that, is homeopathy and dilutions. And these again are tricky questions. You run into things on the internet where people say with absolute surety, based on double-blind studies, that homeopathy is not any better than a placebo. Right? There's interesting questions here. I'm going to talk about them. I'm not going to give you solid answers. I'm just going to help you walk through the minefield of the questions. Okay? With regard to health, we get to make our own choices, our own health. And we're running into a situation, though, where more and more the social order is under pressure of various kinds, and not all of it with our best interests in mind, to force us to do certain things. That is, to take away our freedom with regard to choices regarding our health. For example, the Obama health care plan contains a provision in which we are being forced to buy health insurance. Now, this is not too egregious if you're in the middle class, but if you're working poor, this is horrible. Okay? Now, social policy has done all this stuff about smoking, and everybody that's against smoking says it's unhealthy. But the question is how good is the science behind the conclusions about secondary smoke and other kinds of things like that? If we create a society in which the society feels that it can demand of the individual whatever the society decides is the standard of self-health care, We're on a slippery slope, folks, and a bad one at that. We're going to get into a lot of social problems that can actually be approached from the standpoint of malintended things out of government. That is, they can have intention to do a certain result and they will disguise it as a health issue. And you can read about this in science fiction writers. Ray Bradbury's Fahrenheit 451, I think it's the wife of the fireman in the story, is compelled to take mood-altering drugs. We have legislation in the United States, I don't know if it ever got passed, but it was called some kind of freedom thing, and basically it was legislation that required that people be tested for various kinds of mental illnesses, especially children, and if it was decided that they had a mental illness, they could be involuntarily drugged. And it already exists within the environment where you have a kind of confusion between health issues and sanity, and whether or not a person should be forced to take drugs or not, and whether or not, if they're criminal, what you can do to them. And there's movies about this, some really interesting movies. I'll try to remember some of these movies that one can watch, and there's also interesting books on this issue. It's not a foregone conclusion. If somebody's coming along and pushing medical things onto the people through social processes, these are dangerous steps, and they need to be thought out in a forum in which all the angles are discussed. A lot of what's done with regard to health out on the so-called basis of natural science is epidemiological studies. And what is an epidemiological study? Well, it takes a large group of people and it tries to see whether or not you can isolate a particular fact and say that everybody that gets a certain kind of cancer was around secondhand smoke. How many people were around secondhand smoke? Now, the study will show a high percentage in some cases of the fact that there's a certain factor in the environment and then there's a disease present as well. But the fact is, science doesn't have a causal explanation. It has a statistical anomaly which it tends to interpret as giving you a causal explanation. And this is a sword that cuts two ways, too, because people have issues about the environment and the effects of electricity on people. You know, there's the thing with the cell phones. Do you get cancer if you have a cell phone that you use a lot? You know, does something happen to your brain? Now, the problem again is science at this particular point in time lacks the capacity to provide a genuine causal explanation. And is probably not going to find causal explanations at the level that it needs to find causal explanations until it actually starts to include spirit in its investigations, because spirit is real. However cranky you want to be about it and say it isn't real, spirit is real, and it has an influence on our health, and that's where we're going to go.